All right, let's start today. Good afternoon and welcome to the third and final webinar in this digital health series, sponsored by the PAVE Center from the University of Maryland School of Pharmacy and the National Health Council. My name is Alejandro Rosario. I'm a postdoctoral fellow at the PAVE Center. I will be the moderator today. In the previous two webinars in this series, we discussed digital health terminology and the current regulatory reimbursement landscape. Last week, we heard examples of patient community engagement in developing mobile apps. And today, we will focus on digital health and equity from the standpoint of those involved in digital healthcare delivery and patient community engagement. Next slide, please. It's important to let you know that today's webinar will be recorded and available at the National Health Council website and at the PAVE Center webpage at the University of Maryland, along with the previous webinars in this series. Also, all attendees will be muted during the webinar and you cannot unmute yourself. So please include all questions in the chat. Next slide, please. I want to acknowledge that the Pharma Foundation funds the PAVE Center as a center of excellence in value assessment. And we're very grateful for the collaboration of our partners that make our work possible. Next slide, please. So I'm very excited to introduce our speaker today. First, Jennifer Dexter is the Director of Policy at the National Health Council and has more than 20 years of experience in health policy field. Among her roles, Ms. Dexter helps the National Health Council and its member organizations develop policy positions that seeks to improve the life of people with chronic diseases and disabilities. She has been working on several initiatives to assess the patient's perception of telehealth. She will provide some insight from that work shortly. Our second speaker is Ms. Beverly Butler. She has been a family advocate for over 20 years and is currently contracted by Catholic Charity Family Services, one of the largest behavioral health providers in Maryland, to support families seeking treatment in the residential treatment program. She also leads support groups for families whose children have mental health conditions. Bev serves as a patient stakeholder advisor with the PAVE Center and brings the family and client perspective. Our third speaker is Mr. Juan Caicedo. He's Executive Director of Heritage Care and a community leader who is committed to assisting the Latino community access resources. He's a member of the Maryland Governor's Commission on Hispanic Affairs and the Greater Riverdale Thrives Coalition, where he advocated for the needs of the Hispanic community in Maryland. Also, he serves as a patient stakeholder advisor with the PAVE Center and brings this perspective to the center's work. Next slide, please. So the objectives for our webinar today are the following. First, to discuss telehealth adoption and expansion in the context of equity and access to care. Second, to provide insights of the barriers and facilitators for providing telehealth care. And third, to discuss lessons after 2 years of the COVID-19 pandemic. Next slide, please. Now, here are a couple of definitions for additional context moving forward. So first, as covered in our prior webinars, digital health is the use of information and communication technology in medicine and other health professions to manage illnesses and health risks and promote wellness. Digital health includes use of wearable devices, mobile health, and health information technology, such as patient-provided communication through patient portals. Next slide, please. Within digital health, we will focus on telehealth care, which is the exchange of medical information to support remote clinical healthcare from one site to another. Telehealth, often used interchangeably with telemedicine, includes the assessment, diagnosis, intervention, consultation, supervision, or sharing of medical information. There are different modalities such as store and forward, or also known as asynchronous communication. But like video care, also known as synchronous communication, is a more widely used and will be the focus of our discussion. Next slide, please. Now, today we're gonna be discussing health equity. So in brief, and based on the CDC definition, Health equity refers to the state in which everyone has a fair and just opportunity to attain their highest level of care. In other words, and as shown in the picture, equity occurs when everyone gets what they deserve based upon what each individual needs and the conditions that surround them. Next slide, please. So in the intersection of this term, digital health equity refers to equal access to digital health care and equal outcomes from digital health care irrespective of age, gender, ethnicity, income, and geography. Now, with this introduction, we will now learn from Jennifer about the results of the National Health Council work on with patients, communities, and key takeaways from the listening sessions. Next slide, please. So I will leave it to Jennifer.
Hi, everybody. I'm Jennifer Dexter. I'm the Director of Health Policy at the National Health Council. And I'm just so excited to be here today and so excited that we were able to partner on this series of webinars. The reason I'm here today is that we have undertaken a series of activities at the National Health Council over the last year and a half or so, really focused on both digital health, telehealth particularly, and health equity. And it all kind of came together into a nice dovetailing to have some outcomes and reports to share with you today. So we had the first activity I want to talk to you a little bit about was some work that Elizabeth and Dr. Owen and her team did last year that was really to look at what has the experience of telehealth been for patients. The National Health Council obviously has the most large and small patient groups in the country in our membership. And we picked a subset of those to do some listening sessions with last year to really get their perspective from the patient's point of view. What has been and what do we want to be the telehealth experience moving forward? They were very informative and have served us well both in our program and research work, but particularly in our policy work as Congress is looking at what is coming around telehealth, what are the flexibilities that have been put in place during COVID that need to be extended or not. The experience we had at this listening session has been very informative. So I wanted to share with you a couple of things today, a couple takeaways, particularly related to equity. Is that we need to recognize that telemedicine has been generally a fantastic experience for people, but it doesn't work for everyone and it doesn't work in every situation. From the beginning, we knew that telemedicine has the potential to both reduce or perpetuate health disparities based on how it's implemented. There's a lot of opportunity, there's also a lot of risk. And really what it came down to at the end of the day, what people want is the flexibility for patients in consultation with their providers to have the information and the flexibility they need to determine whether a virtual audio only visit or an in-person visit is the right fit. That is the kind of special sauce that needs to come together to make this work. Elizabeth, can you actually go forward 2 slides? I'm sorry, I actually have one in the wrong order. Thank you. So one of the things we found the more specific recommendations that we had, really what people need is telehealth technology that's designed and tested with diverse patient groups, much like clinical trials or any sort of research that happens. We need to make sure we're listening to people from different backgrounds in different geographic areas with different conditions and health needs. All put that together to really design the future system. One of the things that has been really valuable about telehealth is the partnership with care partners, allowing care partners to sit in, to listen, to have a recording to go back to provide input where they might not have time to go do an in-person visit with somebody. They can join remotely if they're not in the same place, things like that. Supporting multiple languages. This is an area where I think telehealth particularly has a lot to add or risk to have. I was just reading an article this morning actually about the experience of non-English speakers with telehealth and the struggles that has been. But at the same time, if you use the technology correctly, you can bring in, make interpreters available, things like that. And then finally, that it's accessible without a computer via telephone. So that not having access to the technology or broadband, but also not having maybe the resources to be able to pay for the streaming, the minutes and data that it might use up to have an hour-long video visit versus a telephone visit. All of those things come together and are the things we need to consider in the future of telehealth. So this is very much informing our work forward at the policy front and the research front. And the things I wanted to share with you today that I think are the telehealth specific issues. If we could go back one slide and then we'll jump ahead, thanks. So we had the telehealth listening sessions. The other process that we have undergone has been very intensive, which has been a 1.5 year long process of bringing together kind of representatives and thought leaders throughout the whole health ecosystem to really think about health equity from the patient's point of view. So we had a lot of back and forth with our board, with our staff, really trying to figure out what is our role. The NHC and our membership are not able to address the systemic health issues that we have altogether, but where are the places where the payoff for patients' perspective is the highest, and where is the place where the patient community and the National Health Council can be most impactful. So we went through a series of roundtables. We had one about 1.5 years ago with some very high-level thought leaders, really saying what's our lane, what's our space, and spent a long time kind of sifting that out. And what it came down to were 4 core areas. Making sure that there is an inclusive, equitable, and high-quality care delivery system. So that's the experience a patient has once they seek care for something, once they're in a hospital or a clinic or another office, or on a telehealth call. The next one is equitable access to affordable and comprehensive health insurance coverage, making sure that people have the financial support to be able to access the healthcare that they need. The third one was addressing inequity in the social determinants of health. Those are all the things that go around an individual that support their health, both accessing healthcare, things like transportation and availability and community infrastructure, but also the things that keep them healthy, like access to nutrition, financial security, education, housing, all of those things. And we recognize that it's not the patient's community to solve that, but we have to develop better relationships and better interactions to address that. And then finally was equity in medical innovation, which is a lot about diversity in clinical trials, looking at how devices and treatments are developed, how research is done, all of those things. So those 4 key areas are the areas we kind of honed in on. We turned that into a consensus statement that was signed by 58 CEOs of national patient advocacy organizations committing to work together on those areas. And then we were kind of off to the races and explored each of those 4 areas in an in-depth way, one at a time, with roundtables, with our internal infrastructure, with our members, with people outside of membership. About 75 organizations in total helped provide us some input into creating the output from the last year, which is, if you want to go forward 2 slides, Elizabeth, thanks, is the release of a report that has policy recommendations under each of those areas. They are divided into a couple categories. There are a couple principal statements under each, which are high-level kind of non-negotiables. There are short-term policy recommendations that are things that are either in the works, have already been considered, or have the possibility of becoming law, are being worked on. And then there are more complex but important issues, and those are things that we maybe don't have consensus yet around what the exact solution is, or we need to build some political will and momentum around. And those are things that need kind of further exploration. So I wanted to highlight for you, to kind of wrap up my time here, a couple of the key recommendations from different parts of that report that was released February 1st. And I will put in the chat the link to that report so that you can access the full piece when you have a chance. So let me just put it in the chat and then we'll move on. So the specific recommendations that I wanted to highlight for you today that were related to digital health and health equity was one of the principal statements, which is we need to get to a point where access to care is not dependent on patients' ability to physically get to the site of care. So it shouldn't depend on whether or not you live near health facilities. It shouldn't depend on whether or not you have the ability to drive or access public transportation. It shouldn't depend on whether you have a disability that limits your ability to actually access a site of care. While we want to build the idea that providers need to be more prevalent in underserved areas, that providers need to be more accessible and available, but barriers to accessing settings of care, even when they're in their neighborhood, are still going to exist. And it's a place where technology really has an opportunity to address some of that by closing that gap, allowing for remote access and telehealth and remote monitoring and using technology to keep an eye on things as really important pieces. So that was a principal statement that came out. Next slide, Elizabeth. Just generally, there needs to be increased access to telehealth. I think the last 2 years have really proven that it is something that can be effective and work. And it needs to be as flexible and as informed from both the provider and the patient point of view as possible. The other thing is that we need to keep in mind, as we create kind of the future of telehealth particularly, building it with equity in mind. This is a unique opportunity. One of the things that really became clear in our discussions around health equity over the last year and a half are that people are part of our health system was built on foundations that were built during times when disparities and discrimination were part of our DNA. And so they are therefore part of our healthcare DNA. So when we're building a new part of our healthcare system or expanding, we really need to, from now on, make sure that the foundations we're building it upon are designed to make sure that we're reducing health disparities and not perpetuating them. And telehealth is kind of a unique opportunity to do that right now. Okay, next slide. The final one is from the medical innovation report, which is making sure that we're looking at clinical assessment tools and diagnostics and making sure that they don't increase health disparities, and identifying ways that they currently do, and potentially making sure that we're fixing those as well. We think that there is a need to dig in there. That was one of the more complex issues, but one of the more important ones. So that's just a little taste. I'm going to wrap up my little section now, but I wanted to make sure we had that as a base for our discussion going forward. This is the link to the report, Health Equity, Diversity, and Inclusion section of our website. And the link is in the chat as well. So thank you, everybody.
All right. Well, thanks, Jennifer. Those are great insights from the National Health Council work to open up our panel discussion. Next slide, please. All right, so we heard that telehealth could increase access to care, but there are wide concerns that telehealth expansion will widen the access gap. This question is for Bev and Juan. Can you describe how telehealth expansion has impacted access to care? And also, from your perspective, who seems to benefit the most and who appears to lack?
I'll go ahead and take a stab at that first. Actually, I'm Bev Butler. Welcome, everybody. I have the privilege of talking to 1,000+ people every year because I do client surveys for Catholic Charities Family Division. And when telehealth came into our lives because of COVID, I was like thinking, oh, this is going to be terrible. Much to my surprise, the folks that I spoke to were just so pleased that there was an access to care, period, during these troubled times. And the fact that many people have come to really feel more comfortable, especially in the mental health world, using the telehealth services. It's definitely impacted families the most who don't have very good access to the internet, or who are have one phone in their house. Some people did it telephonically, which works for a lot of people. But the folks who have one phone in their family, when that family member had to go back to work, then there was no access to care for their children. But otherwise, what I've seen through telehealth is that mental health patients have consistent treatment now, where people wouldn't get there because of busy schedules or families had to bring all their kids with them. That's all stopped because of telehealth. So that's been a really good thing. So I'll turn it over to Juan now.
Thank you, Bev. Good afternoon, everyone. My name is Juan Caicedo. I'm the Executive Director from Heritage Care Inc. And in this role, I have worked very close with the Hispanic community, the mostly vulnerable community. So I'm not necessarily agree with this statement. What I have seen in my community is that telehealth has opened different possibilities for our community, where I have seen cases where our community have seen professionals in other countries, or of course other states as well. Also, as Beth was mentioning, in mental health, this has been important. I have seen the community reaching different professionals from their countries, where they feel their culture and of course the language is more appropriate, and they feel more comfortable to speaking with. I think the telehealth has given these options that were not before the pandemic, to not only, of course, seeing your primary professionals in your area, but also access other professionals in different states and different countries, even different countries. This also is related to very, very important for vulnerable communities, Hispanic communities that in some cases don't have access to good health or a good health insurance. So for some small diseases and some other conditions, they have now this option to with an affordable price, access professionals in their countries and also in other places.
That's great. Thank you both for those insights. Next slide, please. So telehealth care seems more limited to those with economic or social vulnerabilities, the elderly, those living in rural areas, and with limited connectivity. Also for Ben and Juan, what has been your experience with these barriers? Are there other factors that limit access to healthcare services, or also if you have identified facilitators to telehealth use?
I would say that is one perspective, that it seems like that it just might provide access to more limited to economic, social, or vulnerabilities or elderly. But for some folks, it's given them access, period. You can look at it and say, oh yeah, it's just those, but some people don't have access to care whatsoever. So telehealth opened up the doors. What I'm meaning to that is that you live in an area that just doesn't provide the service you need. And now through telehealth, you can reach out to a provider and have that service. So I think it's been a good thing. And I think that we've learned a lot with people using telehealth. And I think it's just a different perspective. It's how you look at things. But so many people didn't have treatment. I can't tell you how many more people have come into treatment in the mental health world since they can do it via telehealth than ever before. So just wanted to say that.
Thank you.
Yes, and at the beginning of the pandemic, I believe it was a little bit challenging for some communities in terms of not having the proper equipment and also the proper internet connection in their homes for telehealth. In some cases, for example, we donate some equipment and we help also some communities to get access to internet. But as the pandemic progresses, we saw how people start using more, for example, cell phones, particularly we saw as well when the schools closed, they gave laptops to the students, and so all these families also start using these laptops for telehealth. And also we have seen some opportunities that were not before the pandemic. Like, for example, internet providers now are more conscious of this necessity, and they are providing now better plans for vulnerable communities. So this is something that before was not very advertised, or maybe it didn't exist, but now it's very popular, and a lot of people are getting advantage of these plans.
Right. Great, and I guess also other initiative as to decrease cost sharing for these services. We're still discussing if this is going to be permanent or not, but we think that may also be a facilitator moving forward. Next slide, please. So also for Bev and Juan, now that what are the lessons learned about telehealth care after 2 years of COVID pandemic? I know you mentioned some, but can you expand on that? Something in terms of, the workflow, how maybe your practice have adjusted to this, and so on and so forth.
Well, to me, it's been surprising that that now that there are options out there, that many people are still choosing to use telehealth, to do it telephonically and to do it via Zoom. I would have thought they would have been clamoring to go back in person, but that hasn't been true. I think it's shown that people are resilient. I think it's shown that it's a different way to reach out to families. It's something that we never considered before. In the old days, doctors used to come to the house, and people just, that was the way of doing business. And now everybody had to go to them. And then all of a sudden, somebody can be in your living room with you and help you, and you don't have to go anywhere. And maybe you can't get there. So I think that's been really good. I think that the lessons learned is about privacy issues. I think that's been difficult. How do you keep things private in sessions, especially if you have kids and other family members in your house? But when I mentioned that families are resilient, it's amazing how many people have said to me that they find a quiet space for themselves or their child so that they can have privacy. So I think that's been really good. Yeah, I think we've learned a lot, and it seems like in the mental health world that those providers are believing that it's going to go forward, that they're going to be able to get the requirements they need and the licensures they need to continue telehealth. But many people, especially folks who suffer from depression, tell me that they would never want to go back in person. They like the fact that they can either talk on the phone or via Zoom. So I think it's been beneficial.
Yes, I absolutely agree with Beb. I believe telehealth is definitely now a huge tool for medicine, particularly as Beth just mentioned with mental health. I have seen how telehealth have helped our patients also, because they can get therapy in their environment, in their house, and they can get advantage of the tools that are in their house to get a better therapy session as well. So of course there have been some challenges, training, getting used with the software, sometimes equipment, the internet connection maybe sometimes is not very good. So of course the challenges will continue, but I believe the benefit is much better than those challenges.
Right. Next slide, please. Yeah, to wrap up, this is a question for all speakers, maybe starting with Jennifer. And although we have talked about this, could you specifically provide your perspective about telehealth in the future, as we continue in the pandemic and still debating whether to expand or maintain regulation to incentivize telehealth use?
Yes, as I said before, I think, it's just such a unique time, both in with the confluence of the advancements in technology and the need that the pandemic created, I think are really unique. And I think one of the things that is really important is that there is a moment of time where there's so much attention being paid to health equity. People really want to work together to solve this, and want to make a difference and want to fix this, whether that be patients or providers or insurers or researchers or Congress and the administration. There is a desire to work together on this. I think the onus will be on all of us, both to keep the drumbeat up, to make sure that momentum and that attention continues, but also more importantly, really sharing the kinds of information like what I was talking about with the telehealth listening session around the nuance of what needs to be put in place to make this work, to make sure it really doesn't add to health disparities, that we're doing it correctly. So that's kind of my thought, is that there is tremendous opportunity for advancement, but it will be incumbent upon us to really drive that, A, so that it happens, and B, that it happens well.
I was thinking that we really need to be pushing for better licensure, that people can practice if you're going to practice via telehealth. And even in other states, there are so many people that aren't as fortunate as we are who live in the Baltimore metropolitan area to have access to such tremendous health care, and especially special services. And and it's just amazing that people could then finally access that. It would be that would be wonderful. It would be, it's very forward thinking, and of course it's probably somebody else's money that I'm thinking about because I don't have it, is that we be able to give more access to the internet and actually unlimited data plans to people. Would that be part of their insurance premium? Would that be part of what Medicare or medical assistance paid, so that people can have equity and so that they can access the best care possible? Those are all things that we need to be thinking about as we move forward in the future, at least from my perspective.
Yes, and as I was mentioning, I believe telehealth expands to different countries and states. So as Beth mentioned, the licensing for different professionals will be a key for the following years for telehealth. I also see that the use of electronic devices is going to be bigger in our communities, and that could help in the disparities if our communities have access to devices that will, for example, measure the blood pressure, glucose. These vulnerable communities will also maybe control more their health and wellness. So that's very important as well.
Just going to add one more thing that I missed, which is the idea of how do we use digital health and technology to advance diversity and participation in clinical trials. I think that is a significant need, and there's some attention being paid to that right now. But how do we? It's one thing to use technology to access regular care. It's another thing to use technology to access the level of care that's needed to kind of meet the guidelines for clinical trials. And that's a conundrum that we need to solve together. And that is very important because there is such opportunity there to address that issue using technology. So I did want to flag that as well.
All right, great discussion. Next slide, please. So I will open the floor for questions and answers with the panelists. Well, we received one question and really appreciate these insights. For me, particularly, I look more into empirical research about understanding telehealth utilization using claims data. But hearing about the perspective from the providers and the insight from people, the voices from the field, it's amazing and really helped me make sense of what I'm seeing in the data. I have a question for any other speakers. One of the concerns with telehealth sometimes that I've heard or it's even documented is that the provider-patient relationship may be affected with telehealth. And now with the widespread availability and we have more experience, I wonder what you can say about that and what we're experiencing in that regard between the relationship between the patient and the provider.
From what the therapists and some of the psychiatrists have shared with me and talking to them about this issue, that was very difficult at the beginning to try to help to figure out how to engage and keep people engaged via telehealth or on the phone. But I think over time, everybody has gotten so much more comfortable with that it's been helpful. I also think for the clients, they feel comfortable talking to somebody on a screen now versus talking to them in person. I myself would still rather talk to a person in person, but I'm definitely much more comfortable. I do trainings over Zoom and I was kicking and fighting to do that. I didn't want to have to do it. I have to run support groups over Zoom. So I think that the relationships have been able to build because we are all resilient and we've had to adjust and we've been able to adjust. I mean, not everybody has, I know that, but and for some people, face-to-face contact is hard for them, especially people in the mental health world. They would prefer to talk to no one, to talk to a phone. It's just easier and they can, and a lot of times they're talking about trauma and to look at somebody's face and the face is judging them. They don't want that. So they rather talk on the phone, so that's just what I've been hearing.
Yes, with some populations, for example, for children, it has been challenging, for example, for therapy sessions to maintain the concentration. So what we have found is over the time, of course, they get more used to it. But of course, in some cases, you also want to have like a hybrid model where you combine telehealth, but also physical sessions.
Yeah, I think that goes back to the concept I was talking about earlier, like getting both the patient and the provider the information they need to help make decisions on an interaction by interaction basis. Some people, as Bev said, and some people are going to want that really regular face-to-face meeting. Some people are going to want it occasionally. Some providers may say, listen, this is all well and good, but I need to actually see your full physicality and have you in my office every now and again, and work on that with the provider. But we kind of can't force anybody into all telehealth, all in person, all, it really needs to have the flexibility for that care pair to work together and figure out what's going to work best for each interaction.
Well, that's great. So we don't have any other questions in the chat. If there are any concluding remarks, we're getting to the top of the time for this webinar. If any of our great speakers today have any concluding remark, and we can open the floor to that. If not, then we can adjourn. All right, so thank you everybody for your participation. We really appreciate. We are planning another series of digital health webinars, so we will inform you about that. And thank you. Our contact information it's provided in the PAVE Center webpage and also in the National Health Council webpage. So we will be happy to answer any other questions that you want to refer to us. So thank you for your time and have a great weekend.